It's a Northwest News Radio weekend. Now, back to IRG's Health Talk.
We're back, and Brittany Petrie is a physical therapist specializing in pelvic therapy at Sound Physical and Hand Therapy. And Shannon, she's going to talk about the benefits and outcomes of pelvic therapy. Not something you think about much.
Yeah, you don't think about it much, Tom. I mean, people probably don't realize that physical therapists work in the pelvic floor area. It's an area of muscle, and those muscles are important for certain functions, obviously. And it's not a really comfortable topic for a lot of people to talk about, but Brittany does a really good job for us.
Here's Brittany Petrie and Shannon O'Kelly.
Hi, Brittany. Welcome to Health Talk. How are you?
Hi, I'm doing great. How are you?
Oh, I'm doing great. We're so excited, and we feel so honored to have you on today. You're doing a great job for IRG Physical and Hand Therapy and working down in Olympia at South Sound Physical and Hand Therapy for us at the East Olympia Clinic. And you have an interesting background and you have some interesting interest in your PT practice. But before we get into your practice and talk about what you do, I want to know a little bit about Brittany, and so do our listeners. Tell us where you grew up, kind of how you got interested in physical therapy, maybe your education, and how you ended up in the Olympia area. How about that? A day in the life of Brittany. How about that?
Sure. I grew up down in La Center, which is near Vancouver, Washington. And I actually was first introduced to physical therapy in high school. I had back pain, and they told me I had scoliosis when I went to the doctor, and I was terrified. I was, 13, 14. I thought, scoliosis means I need to get rods in my back, and my life is over. They sent me to PT, and I said, why? I clearly need surgery. You're being remiss. They sent me anyway, and I went because, you do what you're told. And my PT was amazing. She taught me what scoliosis was, that mine wasn't that severe, and taught me exercises that helped me feel better. And it was amazing. I couldn't believe it that I went from terrified and uninformed to much more knowledgeable, able to take care of it myself. And I thought, that is what I want to do for people. I want to help people have that turnaround of not knowing what's wrong and being very, very scared to being, I know what this is, and I can take care of it because this person taught me. And it was such a great experience that for me, it just really changed my life, and thought, I want to be this for people. So I went to my counselor and I said, okay, how do I become this? And they directed me to Eastern Washington University. That's where I went to school for undergrad and grad school. And then while I was there, I learned what pelvic floor therapy was. And as soon as I learned about that, I knew that was the thing I wanted to do. Because when I was doing Running Start before all of my actual university time, I took a class where I had to do a project. And it was a very uncomfortable project for a high schooler to do, but I interviewed all the women in my family. We were doing a reproductive history of our family. And I had to ask them all these really personal questions about having children and whether they leaked when they coughed and sneezed. And I was mortified to even ask people these questions.
Yeah.
But it was my assignment. So I did my homework. And I remember sitting in my grandma's kitchen with my mom, asking her these questions. And my grandma's like, yeah, I leak pee when I, cough and lift stuff. And my mom's like, yeah, me too. And my grandma says all her friends at work do. And every questionnaire that I did with every woman in my family, anyone who had had children, they all had this problem. And I thought that sounded terrible. It sounded awful. I was like, I don't want to have kids if that's what happens to everyone who has kids. So when I got to school and realized that there was therapy for that area of people's lives, I was just so excited that that was a thing that we as physical therapists could help people with. What an important part of life to be able to address and make better for people. Just a basic thing like pee when you want. It seems so amazing that we could do that for people.
What a story, Brittany. What an incredible story. So many physical therapists and occupational therapists, and mostly people in healthcare, usually get interested because they had some kind of exposure or an injury. But, you are describing what I would consider a very compassionate, caring, passionate aspect of being a physical therapist, is trying to make a difference. And I love here, I've got a quote here from you, and it says, my role as a provider is to help you, however you are comfortable being helped, and to be your partner in your health and wellness journey. What does that mean to you?
Yeah, so for me, a big part of physical therapy is not just treating the person. I feel like giving someone a treatment is not our style as physical therapists. I think being someone's partner, teaching someone, educating them, telling them why it's important to do the things we're asking them to do, why it matters in their condition, and understanding what's going on with their body.
More with Brittany Petrie and Shannon O'Kelly after this time out on Northwest News Radio.
It's a Northwest News Radio weekend. Here's Tom Hutler and Shannon O'Kelly. This is IRG's Health Talk.
More on pelvic therapy with Brittany Petrie and Shannon O'Kelly now.
Brittany, again, thank you so much for joining us on Health Talk. And more importantly, thank you for the care you provide the community down there in the Olympia area. Let's talk about your specialty training in pelvic floor, and then tell me what a patient would experience when they come and seek you out for maybe pelvic floor therapy.
Yeah, so I've had internships training me in pelvic floor therapy, and then I've taken lots of continuing education courses in it. And to me, like when a person first comes to see me for pelvic floor therapy, my main first goal is to make them feel comfortable and make them feel heard, and then listen to them. And I think that's the biggest part. So many people just say, thank you so much for just listening to my story and what's going on. And then I try to tell them, based on everything they've told me, what seems to be the problem, what's going on, based on my own knowledge and experience and diagnosis and all that. And then explain to them that one of the valuable parts of physical therapy for these conditions is doing an internal assessment of their pelvic floor muscles. And that doesn't always have to happen on the first visit or ever, because sometimes people are not comfortable with that, and that is totally fine. I'm not one to tell someone they have to or they need to leave therapy or anything like that. But yeah, just going through, and I tell people the assessment with pelvic floor therapy is really so much less stressful and invasive than a typical pelvic exam. And people at the end of these visits, they're just like, wow, I'm so glad I came here. I'm so glad now I understand what is happening in my body, because it can be really scary. It's kind of having these like mystery symptoms. You don't know what is going on. And then at the end being like, oh, now I see what is happening, the roadmap to where we're going to get, and how all this comes together into why I'm in physical therapy for symptoms that people don't always associate with physical therapy. It's not shoulder pain, back pain. It's incontinence. It's constipation. All these weird sensations in a part of our body. We're like, oh, I don't even know what those muscles look like down there.
Yeah, it's so funny. I mean, you're so soothing. Your voice is so soothing. I could see how you do really well in this topic because, you know, you and I both know this is not an easy topic. I think people are pretty secretive about this. Tell us, as we wrap up, kind of let's focus on incontinence and how those muscles of the pelvic floor, how you can train those and maybe help in that regard.
Yeah, so one of the biggest things that happens with not having good bladder control is really the muscles are usually too tight. What we often think is that the muscles are not strong enough, and it gets into the idea that muscles need to be functional. So it's not like a tight muscle works great and a loose muscle doesn't work. It's kind of like if you run around with a closed fist all day, that closed fist can only be a closed fist. So if the pelvic floor muscles are just a closed fist all the time, they're not functional. They're not doing their job. They're just trying to hold closed. And then when you really need them to work, they don't do anything but stay closed. And then you can have leakage because the muscle is just tense all day and it can't really do anything else. It's just stuck there. So we really spend a lot of time relaxing muscles and teaching them to be functional. And that's why I put a lot of emphasis on being functional, not just turned on or turned off.
It's good information because I don't think the general public really understands the pelvic floor is musculature, and physical therapists work in that arena. And if you have pelvic floor problems, physical therapy is an excellent opportunity, an excellent choice for you in the right hands, like someone like yourself. And we're going to have you come back on and kind of dig a little deeper in some other areas of pelvic floor. Thank you, Brittany.
Yeah, I would love that. Thank you.
You've been listening to Brittany Petrie, physical therapist specializing in pelvic therapy at South Sound Physical and Hand Therapy, southsoundtherapy.com to get more information. Shannon, you mentioned it is something you deal with, the pelvic floor, and I've heard that term before, and it's something that's very important.
Yeah, it is very important. I mean, if you have symptoms or you have things going on in your pelvic floor, again, it is not a very comfortable topic to talk about. A lot of people won't, but people like Brittany that are skilled in this area can put your mind at ease and can actually help you from a physical therapy standpoint. I don't think a lot of people realize, again, physical therapists work in the pelvic floor area.
All right, our final segment right after this time out on Northwest News Radio.